I would like to add an item to the agenda. As you know, there is great concern out there about the H1V1 virus and the inoculations. And I've asked Dr. Mowat to come this morning and at the very beginning of the meeting just to advise the public and the many people in attendance this morning because of the concern, and especially the death of the young lad this week. And so if Dr. Mowat, as soon as the agenda is adopted, I would ask Dr. Mowat to come forward. I think it's very important that we get as much information out there as possible. I've had many questions asked to me as to whether they should get the vaccine. And so Dr. Mowat will bring us right up to date on the action by the Peel Health Unit in regard to this.
Madam Mayor, Councillors, thank you for asking me to come and say a few words about the H1N1 influenza virus. I'll keep this brief. As you may know, we've been planning for years for a pandemic, and our own plan dates from 2007. The word pandemic, of course, as it's currently defined by the World Health Organization, refers only to the distribution of the virus, not necessarily its severity. Our experience watching what was going on in the southern hemisphere over the last few months showed us that this particular virus is generally mild, but rarely, as so tragically happened recently in the GTA, it can affect young people who are otherwise entirely well, and within a very short period of time they can end up in intensive care on a respirator or may even die. We are seeing that same kind of story that happened in the Southern Hemisphere here today. The first wave, as you know, was in the spring, and it was not of any great consequence. The second wave, as we're calling it, is now starting. And, for example, London, Hamilton, Kingston, Ottawa all have many cases. Here in our area, we have a number of indicators that we keep an eye on. And for example, the proportion of nasal swabs that go to the laboratory, the proportion of those that are positive for H1N1 has leapt up from 5% to 20% in the last week or so. Some other areas it's as high as 50%. We're keeping an eye on the emergency room, and some doctors do report to us daily, and there's no doubt we are starting to see many more cases of influenza. I want to bring to you three recommendations around this. One is to remember the elementary elements of hand hygiene. Washing the hands frequently with soap and water, or where that's not available, an alcohol-based hand rub. And I'm glad to see that they are widely available in our community and are being used. When coughing, cough into the sleeve, not the hands. Clean hands after using a tissue. Clean, high-touch surfaces. And possibly the most important, stay home, do not go to work or school if there's any signs of illness. Second recommendation concerns what we're seeing in our healthcare system. We are seeing more and more people going to emergency rooms, but we are not seeing the number of admissions going up, suggesting that people are worried for them. They are sick. So to use the healthcare system wisely, call your own doctor and only go to the emergency room if there's a clear need to do so because of the severity. We know that in our community there are people without family doctors, even some without OHIP. So we are watching carefully, and we have plans in preparation to open 2 flu clinics or alternate flu assessment centres, given the correct name, which will help out if the healthcare system starts to get too busy. Third is the vaccine. There's been a lot of discussion about this vaccine in the media. Excuse me. It is now available. We are starting to get the first doses in stock at Peel Public Health. operating our clinics, and I have brought with me some lists. You'll also see this in the paper. I point out that those are revised frequently. We are going to be operating 4 large clinics in the region of Peel, 2 in Mississauga, 2 in Brampton. We have reassigned almost all of our nurses. We have hired every agency nurse we can get. We have brought back nurses who have retired, and we have brought in all of our casual nurses full-time. So we have done everything we can to provide the volume that we can. And we are all, the late decision by the province, the vaccine will also be available through family doctors. We're very grateful for this because it means there'll be more places for people to get the vaccine and to get it early. There could be some discussion about the location of these clinics. Very difficult to find locations, particularly those that have adequate parking and are available throughout the period. We will also have some what we call roving clinics to fill in some of those blind spots. A reminder of the priority for getting the vaccine. We have already yesterday and today started one clinic at the International Centre, and this week we are pitching it towards those in the first priority group. Those would be healthcare workers, those under 65 years of age who have some form of health problem that would make them more likely to get seriously ill if they catch it, pregnant women, and we are asking them to go to their own family doctors, and children slightly behind that priority group, children aged 6 months to 5 years, and caregivers of people who can't take the vaccine. Yesterday we distributed the vaccine to hospitals and long-term care centres for them to immunise their staff, and as of right now we are shipping it out to those family doctors who have elected to take the vaccine and provide it to their own patients. So that's a brief run through a few points, and I'll be happy to take any questions you may have.
Thank you very much, Dr. Mowat. The question that I've been asked a number of times is the age over 65 and under 65. So I'm sure many of our councillors will ask those questions. Councillor Prentice.
Thank you, Madam Mayor, and thank you, Dr. Mowat, for being here. There have been so many inquiries about where and when and how old, etc., etc. So I'm glad you're here to clarify it. I, too, have received calls, mainly from people over 65, that are not clear as to whether they should get the H1N1 at all.
Right, and that is somewhat complex, so I'll try and simplify it as much as possible. The H1N1 is one kind of flu. We know from experience elsewhere that the regular seasonal flu can also occur at the same time. For example, in the Australian experience, overall about 10% of their cases were the regular flu. But we also know that once H1N1 takes a hold, it tends to push the other flu right out of the picture. The seasonal flu vaccine was available first. So at that time, knowing that it is those over 65 who suffer most from the seasonal flu, that was made available just to those over 65 because we had to get it out there and into people's arms as quickly as we possibly could. So, for example, family doctors, of course, and our health department pushed back our clinics to get them done before the H1N1 came. So they are now finishing this week. So we did recommend to those over 65 to get the seasonal flu shot.